Welcome back to the Morning Blend. So is your child having trouble seeing what the teacher is writing on the board? Well, it's not just the supplies kids need for the school year, but a checkup as well.
That's right. Get your kids' vision back in focus thanks to the help of Dr. Adam Rovit of Shepherd Eye Center. Good morning to you and welcome.
Good morning. Thank you.
Now, first off, can you tell us a little bit about your background?
My background is I'm a pediatric ophthalmologist, and as an ophthalmologist, I'm an MD, so I went to medical school, completed a residency, and then did some fellowship training specifically in pediatric ophthalmology, children's eye exams.
Now, what are some of the most common conditions you see in children? We have some pictures to kind of illustrate. But
well, the most common, here's some pictures showing some ocular misalignment, which is one of the more common things I see referred to me. This is a child with exotropia, eyes that drift out, and these are eyes that drift in. The most common thing I see is refractive error, and that is nearsightedness, farsightedness, astigmatism. And one of the other conditions that is fairly common that we see are children with lazy eye. And this is lazy eye is one of these terms that's generally used by many people and refers to many different things, but for us, it's an eye that doesn't see well, and usually because of a big imbalance between the focusing of the two eyes. And this is one of the things that your pediatrician is screening for in the office in terms of reading eye charts. They're examining the children with optical devices to make sure all the structures look normal. But these are some of the more common things we see.
And these are conditions that can be treated?
Well, they can be treated, but the important thing, especially with a child with amblyopia or lazy eye, is to see them early on. Because the visual system, we use the analogy, it's sort of like concrete or cement. When it's first set, you can make changes in it and improve things, but once it's set in stone, usually by the time a child is 9 or 10, unfortunately those conditions can't be improved at that point.
Yeah, I know the misalignment is something that can be taken care of. And I've always wanted to ask this question. Optometrist, ophthalmologist.
Right.
What's the difference?
Optometrists are doctors of optometry. They go to a 4-year school, and they are instructed in terms of structure and diseases of the eye. Their main focus is optical correction. They're the ones that prescribe glasses, contact lenses, and they usually have offices that prescribe glasses and contact lenses as well. Ophthalmologists are IMDs. We, as I said, go to medical school, do residencies. We are eye surgeons. We treat medical eye disease, and we also do optical eye care. We do general eye care in our office, glasses and contact lenses as well.
Excellent.
And you can do surgeries.
Right.
Now, let's talk about how do we assess vision in kids, especially when they're really young and they can't speak.
Right. Well, your pediatrician is doing some examination right off the bat in terms of making an assessment. Are the child's eyes straight? Do they seem to be seeing with both eyes? And are the structures normal? For children that I get referred, really young children, the first thing we do is we check their fixation, and we have a fixation. I have a friend who's a neurologist who always carries around a reflex hammer, and I always have this, and it's amazing. Wow. Children can't seem to not look away from this, and many times all you need is like a minute, and sometimes that's all you get. So you're checking their fixation. Are they following the target?
Yeah.
For a little older children, we have movies set up, cartoons and so forth. And then when they're old enough, we actually, certainly use the eye chart. And I think, here's an example. So you don't have to have, this is a symbol chart. So all they have to do is, pick out the symbol, so you don't have to wait until they can actually see letters in order to identify.
That looks more fun than for the adults, I think.
Yes, absolutely. So that's how we assess it. The other thing is, when we put drops in, is really how we assess the eye is an optical system. You wear glasses, Dow, and I tell parents this, and they say, well, how can I figure out when I see a 2-year-old, they're reading the chart and they're picking lenses, and the answer is they aren't. I could examine you in the office, either with dilation or without, and I could give you a prescription for glasses without ever asking you to read anything. And the eye is an optical system, so we shine a light in a dilated pupil. We use lenses to neutralize that reflex on the retina, and that, by definition, is the power of the lens that's necessary to focus light. So we can tell with your child if there's a big problem or they need glasses.
I remember as a young kid sitting really close to the TV and my grandmother saying I'm going to go blind if I sit that close. Is this an old wives' tale, or is it true, like, if you're too much screen time can actually affect vision? Well,
it doesn't affect vision or cause you to become nearsighted. To the best of our knowledge. I mean, there are studies that are ongoing, but, and I get this asked all the time, my child spends so much time on their phone, on their device, are they going to develop more nearsightedness? As far as we can tell, the answer to that is no. But on the other hand, we know that nearsightedness as a problem worldwide is definitely increasing, especially in Asian populations. I mean, it has gone up a huge amount. And what's causing that, we don't really know.
Wow.
About standing close to the TV, a very common thing we see, and most of the time it's not a problem in terms of focusing. But as you know, the closer you are to something, the bigger the image is on the retina, so it's just bigger, and that's why children like to get
And that's
close.
why he's got a bigger TV
Well,
now.
he's
upgraded.
Get a 20-inch
Yes.
TV, you put it up close
Yeah,
to your
there
head,
you
it's
go.
500
There's the
inches.
answer.
Can
There
you tell us about your locations?
Yes, so I go to 3 offices, and I'm on the west side in Summerlin.
Okay.
I'm also in Green Valley, and then we have a newer office that's off the 215, which would be the southwest 215 between Sunset and Russell.
Excellent. Well, it's great having you. Thank you so much. Great information.
Yeah,
Thank
thank you. Again, Shepherd Eye Center has 3 locations here in the Valley, 1 in Summerlin, 1 in Henderson, and 1 in the Southwest. For more about the group, check out the website or call the number listed. And don't forget, you can find us on Facebook and Twitter.
Links can be